Well, as our temperatures drop, cold and flu season ramps up, and your primary care provider is here to help you stay healthy and know when to seek care. We've got Tracy Mulder here. She's a PA with Trinity Health to help us. Tracy, thank you so much for being here.
Thank you for having me.
So let's talk about the difference between a cold and the flu.
Yeah, they're both viruses, but they present very, very differently. A cold typically starts very mild and symptoms will gradually build, whereas the flu, you feel miserable immediately. High fevers, body aches, just generally feeling unwell quickly.
Yeah, hit you like a ton of bricks,
Yep.
right? So how does someone, who should be getting a flu shot and when?
Yeah, anyone over the age of 6 months is eligible for a flu shot. We recommend that you try and do it before the end of October so you have coverage for the full flu season. You can get it at your primary care office. Some have extended hours for flu shots, and also pharmacies offer them as well.
Okay, perfect. So now someone says, say someone starts to get sick, when do they know it's time to go to the doctor?
Yeah, so if it is severe symptoms, if you have high fever not responding to over-the-counter medications, or shortness of breath, really important that you be seen to make sure that there's nothing else going on.
Okay, so a timeline though, like how long do you go?
Yeah, no more than 10 days with symptoms.
Okay. And what about telehealth in there? Is that okay to hop that on and then figure it out from there?
Well, telehealth is helpful to kind of differentiate when someone needs to be coming in, but if they're short of breath, it's always best to come in and have your lungs listened to.
Okay, shortness of breath, get in there and see somebody. Okay, perfect. And what can we do as we're going around to try to keep ourselves healthy besides getting a flu shot?
Yeah, wiping down counters that are often touched, not touching your face, making sure when you are sick that you're staying home, and generally just good hygiene habits.
Okay, just to keep it clean. All right, what about the littles? I know it can be really, really hard and they're, little germs bringing things home. Are there ways to go above and beyond for our kids?
Just again, making sure they're washing their hands regularly, that wherever they are, whether it be at school or daycare, is that we're wiping down those counters and then trying to encourage them not to touch their face if you're able to.
Okay, perfect. All right. And, is there anything else that people need to know as we go into cold and flu season?
Just protect yourself and others. If you're sick, stay home, protect the elderly because they're much more apt to get these illnesses.
Okay, perfect. And get that flu shot ASAP.
That's correct.
Right? And you can get it anywhere. You can go to the grocery store and get it at the pharmacy if you'd like.
That's right.
Perfect. Well, gosh, we really, really appreciate your time. Thank you so much. So yeah, if you need to get in and see someone or just make an appointment with your primary care physician, trinityhealthmichigan.org/primary care, or it's as simple as going to your MyChart app and scheduling your appointments there.